Hello, beloveds. I'm so happy to join me today. This is a difficult video to make. I've been putting it off, I should say, because it's been a very difficult week. Today is Saturday, the 23rd of September, 2023, and on the previous Tuesday, I had my last meeting with John Stranix as my surgeon, and that was about a little over 4 months after the surgery. Accompanying me was my father, which was nice, and also there were my urologist, who also does bottom surgeries at UVA, Sean Corbett, as well as the manager of the plastic surgery department, at my request, just to see if there was like a non-medical, well, he's medical, he's a registered nurse, but someone else who might be able to be present and witness to this problem. And it was a very difficult meeting for everybody involved. It was difficult for me. It was really difficult for the doctor. I was mostly hoping to make sure this didn't happen to anybody else. And I was also interested to see what could possibly be done for my case. I'm gonna do a summary first, and then I'll go into the details. Just for those of you who want to click off early, because I know lots of you do, I see the stats. So, as for where I'm at, there's not a lot of hope. This outcome was not expected. I was not warned of it because it's not normal according to him. And, nerves take a long time to recover, but based on what I felt already, recovery does not seem super likely. So, I don't know what to do about that. I'm not even sure what to do about this flickering light. So I don't know what to do next, but I will see some second opinions. And I'm going to see one that he referred me to on Monday, which honestly I'm a little suspicious about, because if it's his friend, are they really gonna be honest, or are they just gonna cover his ass? And then I'm also gonna go see, that's Dr. Ramanini. And then I'm also going to see Gabriel Alfonso de Corral, who's a reconstructive plastic surgeon at MedStar Health up in Northern Virginia and Washington and Maryland area. So I'm trying to get that appointment now. And at this point, I'm just like, I spent a few days just kind of dazed after that. I had a horrible headache after that meeting, and continued. It abated a few times, but it continued for a couple of days. As for the doctor, to paraphrase him, he's not someone who's used to being wrong. He's not someone who's used to not having a solution. So this is all kind of shocking to him. And I can tell, he is the guy who's always right, and he's the guy who always knows what to do. He's not the guy who's a fuck-up, and for him to be the fuck-up is very strange, I think. It definitely seemed like he was a bit humbled. And I could tell he kept trying to kind of say whatabouts occasionally, and I had to shut him down quite a few times. like him saying he never got rid of any of those parts, but it's true, he didn't get rid of them, but they're dead. They're not there anymore. The parts where he thought he explained things, but he didn't. I think the best thing to do is look in the description and see what I actually, my notes for it. What my notes were not exactly the same thing, but I don't know if if I'm gonna get into litigation, I won't share the recording just yet. But there were a lot of issues with the labia, especially, and because of that, I've been struggling with incredible pain, which he did not anticipate either, he said. And he did not want me to go through that, but it did, and he was also very absent. And I told him, it's clear that you don't know what your schedule is, because you told me to make an appointment for within 2 months, but I couldn't get one for 4.5 months, kind of thing. And he's just not there during aftercare. It's not right. That he didn't discuss the anticipated changes through healing beforehand, that the vaginal entrance was really not functional anymore than it was. He said he released it 5 centimeters. I'm not sure what that means, honestly, but it's still not working. And just a sign that, he suggested something without fully talking through what that meant surgically and what the outcome would actually be with me. Which was kind of, his MO all the way through. And of course, being very unhappy with where he did the fat grafting from. But of course, the main problem is just my loss of sensation. Thankfully now, the incredible pain that I've gone through is much better controlled. The medication I'm on has helped, as has the meditation. And I am feeling that there's really not much more that can be done for me, based on what I've heard by medical practices. So now I think the best option is to go into the universal field, the general field of reality that exists in all ways, in all dimensions, in all spaces, in all densities, and make my manifestations there with collective consciousness and co-creation. Because the more of us who change our beliefs in that co-creation to believe something else, the more things will actually change. There is power in numbers, for certain. And I can do some things by myself, but honestly, in this case, I think, even though I am a part of the whole and the whole is indivisible, the stronger an impact we can have as a group, the better off we will all be. And as such, I'm going to make all of my things directed at the whole, not just at myself, but at healing everybody. This will probably come out after that event, but if I do get it out sooner, then please join me at the event. You'll see it on my page. So I'm going to quickly read through those notes from that I went over at the meeting. And yeah, you can listen, you can hear what it is. So Because of your lack of just imagine me face to face in a small room with John Stranix. Because of your lack of discussion with me about both the process and the healing of the surgery, I wound up with a result that seems to have permanently disabled my genitals, and has given me a degree of sexual trauma that I don't know when or if I will ever be able to heal from. As such, I have many questions about the whole process so that I can better understand your thought process, because you have much experience and many people think highly of you as a surgeon, and yet you seem to have gotten everything wrong with me. UVA is a higher learning hospital, and everybody should be able to learn from my ruined genitalia and how to fix the process and procedures. Problems with the process. 1. No clear discussion of goals where both parties understood the path. 2. No clear explanation of the surgery in detail. 3. No warning that this disaster was a possible outcome. 4. Inadequate aftercare because you are overbooked. 5. Lack of empathy and understanding of a transsexual woman's goals. There were a lot of details both in the process and in the predicted outcome and the healing process that you did not tell me about, and I'm trying to understand why you thought it was unimportant to tell me all of these details. As a result, I'm in a place where my body is much worse than it was when it started before surgery. I was trying to get a vulva that looked more natural and less like a surgery site, but now I have one that still looks like a surgery site and is also much less functional as genitalia. You caused the death of all the skin from the top of the penis. This effectively chopped off the top of the penis and threw it in the trash. You did not allow me to have informed consent because when I directly asked about if the labial alteration could cause nerve damage, you said, "I don't see why that would happen." I want you to know that would have been less damaging if you had raped me 100 times than what you did to me. This is gross sexual misconduct of the highest order. I want you to realize the gross misconduct you perpetrated when you did not give me full understanding that this would be a potential outcome. You did tell me there were potential dangers, but you completely glossed over them and provided zero detail as to what that could possibly be. Details are necessary to understand the risks, but I did not hear about those. Had you enumerated risks, it would have been possible to conceive of what they could be. I'm trying to determine what can be done to fix my vulva enough to make life worth living. What can be done? And then we go into the interventions, and I asked him to take a look at me, and he did, and he could see how all of that skin was basically gone. He thought it had released back into it, but I had to correct him and saying no, it shrank back into nothing. It never released. All of that skin just got absorbed into the body. So, is that the result you expected? No. Why didn't you tell me how much skin you were going to take from the labia majora in advance? I never got a good answer on that. In our pre-op appointment, I specifically asked you if there was any possibility of nerve damage, and your response was, "I don't see a reason why it could happen. It now appears that I have massive nerve damage, and yet you did not tell me that was a possibility. What happened?" So basically, anyway, I go on here, but I had already said that before, and he was saying that he did not see that was a possibility even. So I guess he's just an inadequate doctor. Do you think it would have been a good idea to tell me that it would be possible you would be taking some of the most delicate, sensitive skin and making it a scar? Again, no response. I don't know, I shouldn't say that. It says, I might release that sometime, but I'm just going to read through now because it's just like, He tried a lot of weak sauce kind of responses, but he didn't really. So he thought his stitching would not, have interacted with the blood flow in any way, that was all cleared, but for clearly not adequately. So he's very sad about making my vulva less functional. It was not intended. So another one, we did not discuss what it would actually look like other than it would be 0.5 centimeter. If we had talked through how this would actually be, then it would have been obvious that this would have been an incredibly ugly result, and I would have been unhappy with it even if it hadn't died off and left me numb. It would have looked nothing like a natural labia, making something that not only decreased function aesthetically, but also decreased function sexually. Why didn't you tell me that you would cut off the end of the labia minora skin to make an unnatural labia shape at the entrance to the vagina? At this point, all of that skin has completely died, so there's no labia minora. Still, you should have warned me that you would be doing this, so I would have been able to have had informed consent. Tell you this would have been unacceptable. Why didn't you make a labia minora that was shaped like a natural one with a flare around the urethra and something that wrapped all the way around the vagina in a natural fashion instead of stopping short in the truncated fashion you did? Why didn't you discuss your anticipated changes through healing beforehand? Not knowing what you expected caused me incredible stress between surgery and the first post-op appointment, as I thought from the moment I awoke after surgery that something had gone completely different from what we had discussed. I am now unable to sit for more than 10 minutes without having problems with blood flow to the labia and surrounding areas, and having overwhelming numb sensations and loss of sensation from all the penis skin. This is another catastrophic problem you did not warn me of. So I'm repeating myself, but I'm obviously pissed. You did not protect patient rights when writing the meetup notes. My pre-op medical records were falsified, saying I was given warnings of potential problems when that is clearly not the case, and if I had, I never would have agreed to this horror show that has completely ruined my life, making it most likely impossible for me to ever enjoy sex again. The vaginal entrance. Surgical intervention suggested and performed did nothing to improve the function and use of the vagina. Skin still covers the entrance in some positions. It only works right when I am on my back. In several other positions, the entrance to my vagina is covered by skin from the perineum. I'm concerned you did not consider the totality of skin tension and position, and what would actually be necessary to give me fully functional vaginal access. Fat grafting. Numbness is still persistent at the belly, and that was mentioned only very casually right before surgery and not in pre-op. Why was I not told about this from the beginning? I did not feel I could say no by springing this on me. Because of where you took the fat graft from, you have made my belly look more masculine, which I am very unhappy about. Why didn't you choose a way to make my belly more feminine? Before surgery, you told me the area I wanted would not work, but the area you chose was not appropriate. The location you chose may have been easier for you, but it was completely inappropriate from the point of view of female fat distribution, which is so critical for me. I would think it would be obvious that this would be a terrible result for a transsexual woman. What you did has made my body dysmorphia much worse. Why didn't you discuss the intended outcome of the fat grafting with me at all prior to surgery? Now perhaps I would need more liposuction that I don't want to make my body female-shaped again. And what happened to all the fat? It seems to have mostly disappeared. You did not mention this to the degree, and it was a pre-op appointment. I mean, they talked about it, but very minorly. Not in terms of the actual amount. So, and again, just a very sloppy communication all the way through, and at the beginning, which is what kind of made this disaster, I think. You know, not telling your patient about how things are going to heal and what the surgical steps are before, and making them be in psychological trauma in addition to the physical trauma is not good for healing. I don't know how it affected me, obviously, because I don't have a control group, but certainly not a good way to go. And now I'm going to go see some other doctors to see if this was at all conventional or abnormal, like if it's just my body that's weird, or he did a botched job, or how can they even tell? So that's what I'm trying to find out now. So I'll keep you informed of how it goes. At least I'm feeling a little bit better the past few days because, oddly enough, I was thinking for a bit that I might be losing my job, and then once I got over the initial shock of that, I was just like, God doesn't give you more than you can ask for. It just cracks me up. You've got it. The game is a little harder for you now that you're getting better at it. The levels, you've gone up a level. Anyway, please give me your questions, and I hope to see you on the live stream coming up. Well, if it's still in the future, it might be in the past, but you're welcome to watch it anytime. And if it goes well, I just might have some more. I'm looking forward to it. I feel like that's something I need more. I need more of that life. I need people working together to make a better world around us. So. You are infinite. You are blessed. You are all things. You are I am. You are I am that. You are. And so, all blessings to you, dear ones. I love you. Aloha.